Hello again, Danksters. Let's continue on our discussion on the prescription process. This is part 2 of 3. If you missed the first part, go ahead and view that one. We're on part 2. If you're new to us, welcome. And if you're returning, tell a friend if they're interested in learning more about pharmacy, or if you have a grandparent that's taking tons and tons of drugs and want to learn more about their own health, give them the link and they can learn as well. All right, today's learning objectives: safety. So preventing medical errors and identifying the differences between what a pharmacist can do and what a technician can do. And then next time we'll conclude it. The filling process. So preparing the prescription. So make sure you select the correct drug. We still use the triple check system, even in pharmacy. You're going to check the drug initially when you pull the med, and then when you fill the prescription, and lastly when you restock the medication. So that is our triple check system. In the medical field, your third check is right before you administer the dose. In pharmacy, the NDC number for the drug will be on the label. So ever in doubt, just match up the NDC number on the label with the NDC number on the stock bottle. NDC stands for National Drug Code. It is a 10-digit number that specifies that exact drug product. Measure and package. So make sure you don't put 10 pills in a large vial or stuff 100 pills in a tiny vial. And lastly, affix the label and any auxiliary or warning labels. So those will provide additional information and safety for drug administration. Many common errors that can occur. First one is sound alike, look alike. A lot of drugs, many drugs, top 200 drugs have a lot of sound alike, look alike. The more you get familiar with them, the easier it'll be. Wrong strength, wrong dosage form, quantity. So definitely dosage form. Not all tablets are the same. They have different release mechanisms. Same with capsules. Not all capsules are the same. They may be in extended release form. Wrong directions. So go back, take a look at all of your SIG codes assignment, and let's strive for 100% accuracy to ensure patient safety. Medication given to the wrong patient. This occurs often during the bag stuffing. So all the prescriptions were filled, checked, and they were completely done. But you'll put the drug and stuff it into the wrong bag. And when the patient takes it home, they don't read the name, they just read directions, and they start taking medication. And that's not even theirs. Forged or altered prescription. For narcotics, we'll usually write the count in parentheses and spell it out as in 30. That way it doesn't get changed to simply 80. It can be altered to 80. And check for different color inks, different ink pressure, etc. The pharmacy technician's role. So really you only have to identify what only the pharmacist can do. Most tasks can be done by the technician in the assistant role. Treat patients' information and medication, definitely with respect. Pharmacy techs can take in the scripts, can fill them. They can send the requests to the doctor for clarification. But if the doctor calls back, it's the pharmacist that will need to receive the verbal clarification. Third-party adjudication. So if you caught that in the first one, adjudication is just the electronic processing of prescription claims. Techs can fill prescriptions, techs can compound, and of course record control substance. So for C2s, you have to have a perpetual inventory count. Anything that can't be done by the tech must be referred to the pharmacist. So it's going to be a little bit different from the medical practice where the MAs will be providing patient education on medication. And then lastly, ensure safety and accuracy throughout. The pharmacist role. So the pharmacist is in charge. So anything the tech does, the pharmacist can be held responsible for. So you got to be careful. So correct drug product to the correct patient, ultimate role, ultimate responsibility. Directions are clear. So when they do their second check of the fill, counseling the patient on how to take and refill meds. So that's part of counseling. Doing the drug-drug interaction, drug allergy review. So this is under OBRA. Under OBRA 90. DURs are required. Patients aware of benefits and side effects. That's still counseling. Accurately bill, definitely. You want to prevent fraud. The NDC number that you billed should be the NDC number that you filled. And then only the pharmacist can counsel patients. Only pharmacists can take new scripts, but techs can take refill authorizations over the phone. Review questions. Give examples of different DAW codes. So first of all, what is DAW? DAW is dispensed as written. So usually it's the doctor. But if there is no DAW specified, that can be initiated as well. So the main thing is for the insurance company to justify the cost of the medication. Dr. DAW, so if it's a brand, then the insurance company will know why it's a higher cost. The doctor wanted it. Patient can request a certain brand or generic. This is most likely the placebo effect. They may like the brand name instead of a generic version. Pharmacist can recommend a particular brand to dispense. If there's no generic available, then we can only dispense the brand, hence the higher costs. If you are out of generic, you can provide exceptional customer service by providing the brand, but charging them the generic price. Okay, let's identify if the following tasks are pharmacists only, tech only, or both. Offer counseling. Who can offer counseling? Well, everybody must offer counseling. Anybody can offer counseling. But who actually conducts the counseling? That's going to be pharmacists only. New phone prescriptions, that's a verbal order. That's going to be pharmacists only. Whereas refill authorization, the technician can take that. Nothing's changing. It's just another fill, same drug, same direction, same patient. Overriding drug interactions. During the process of entering the prescription, you may have warnings that pop up. That's part of DUR under OBRA. And it's really easy to bypass. All you have to do is push enter and you can just continue. However, you must call to the attention of the pharmacist and have them clear it for you. Have them say okay. Right? If you don't, then the technician may be held liable because they never allow the pharmacist to know. Compound prescriptions. Only pharmacists and pharmacy technicians can compound. So a nurse can't compound, a veterinarian can't compound a beef flavor suspension for a dog, It's only a tech or a pharmacist. Inform patients of side effect. Well, this is part of counseling, so pharmacists only. Inform patients on how to take medication. Again, that's counseling, so pharmacists only. All right, that concludes part 2 of the 3-part series on prescription. So coming up next, we got part 3 of 3. That'll end this discussion on prescription. And as always, thank you for joining DangTeach at CCSD. And you guys have a wonderful day.